So the first thing I'm going to do is perform hand hygiene and then verify the order and hospital policy, then identify the patient with the two identifiers, so Jaguar J. Jones, MR number 4176352, MR number 4176352. His allergies are penicillin and penicillin. And I would ask if there are any other allergies I need to know about today. And then I would gather my equipment. Then I would perform hand hygiene again and raise the bed to a working height and lower the side rail. And then I would assess the patient's vital signs. I would put my pulse oximeter on the patient's finger, and I would assess oxygen saturation and auscultate the bowel sounds. And then I would open my NG tube packaging, which I've already done, and I would get my tape ready, which I've also already done. And I've also already measured my tubing and have my dog-eared tape marking where I'm supposed to insert to. So now I'm going to loosen my syringe and put a dollop of lubricant onto the inside of my NG tube packaging. And now I would explain the procedure to the patient and provide privacy earlier. And now I can place my large basin onto the patient's abdomen and raise the bed to a high Fowler's position and put my goggles on and my clean gloves. So I would establish a queuing sign with the patient for if I need to stop the procedure. About the vital signs, if pulse saturation, if oxygen saturation decreases or if vital signs deteriorate, then I would stop the procedure until patient's stability is determined. And now I'm going to coil the end of the tubing around my hand and assess the patency of each nair. So I would occlude one nair at a time and do this bilaterally and ask the patient to breathe normally. And then when I decide which nair I want to use, I'm going to clean the patient's nose with soap and water or an alcohol pad and pat dry. And now I'm going to curve the tip of my tube one more time, and now I'm going to lubricate 4 inches. Now I'm going to start inserting, so I'm going to insert 1 to 2 inches at a time, rotating 180 degrees. And once I get to the nasopharynx, I'm going to ask the patient to take sips of their water or dry swallow. And if the patient were to start coughing, or if oxygen saturation decreased, or if there were any other signs of respiratory distress, then I would pull the tube back into the posterior nasopharynx and wait until the patient was breathing normally again, and then I would ask them to swallow, and then I would finish inserting. So now that I've reached the marker that I placed previously, I can get my temporary piece of tape and secure the NG tube to the patient's cheek. And now I'm going to assess the placement of the tubing. So I'm going to look inside the patient's mouth with my pen light and hold the patient's tongue down with my tongue depressor and examine the tube at the back of the throat. And now I will attach my 60 milliliter syringe to the tubing and test and aspirate the gastric secretions. And then I would test the pH to make sure it was acidic if indicated, and I would have an x-ray performed if ordered. So now that I know the tube is in place, I can remove my piece of tape that I used as a marker, and I would use the skin prep on the nose, and now I can get my pre-cut piece of tape and secure it to the nose, remove my temporary piece of tape from earlier, and attach the other end to the tubing. And then I would mark with a marker, and I would clip the tubing to the patient's gown to make sure that they can move their head. And now I'm going to demonstrate how I would do suctioning. So, well, first, this is how I would leave the tube if it were locked and not in use. So for suctioning, this is my suction tubing, and I would attach it here. And I would have the blue tubing above the patient's stomach and turn the wall suctioning to low intermittent. And then I'm just going to leave that there. So, and now I'm going to place my labeled piece of tape on the bridge of the patient's nose. So now that the NG tube is inserted, I can remove my gloves and dispose of my supplies, remove the towel from the patient, and perform hand hygiene. And then I would lower the bed to the lowest position and lower the back of the bed, making sure that it stayed above 30 degrees. And I would assess the patient's comfort and make sure they have their call light. And then I would go to document. So I would document the size and type of the NG tube, the suctioning, the time, the location or the right or left nair, the way the location was verified, and the way that the tube was secured. And then I would also document the color and amount and characteristics of the secretions. And so then when I come back into the room to remove the NG tube, I would perform hand hygiene, verify the order, and assess the bowel sounds again, and then apply my clean gloves, turn off the suctioning, take the tubing off of the gown and remove the tape. And I would ask the patient to take a breath and hold it. I'm kinking the tubing, and then I will slowly but steadily remove the NG tube. And I would dispose of that, and then I would measure the secretions, perform oral hygiene, and document.